In the December 2009, I knocked myself on a car door, and after that I then noticed a lump sort of there, and I thought, well, there's nothing of it. Saw a doctor, they had a feel around, gave me an ultrasound to feel around it as well with an ultrasound, because men can't have a mammogram, and they said, yes, there is a lump, don't think it's anything to worry about, Mr. Tokely, we'll book you in. And they did, done a little incision and popped the lump out. It was about a week, 10 days later that they then phoned me and said, you know, we found something in this lump, can you come back in? I came back in, not still thinking it was cancer or anything, just went there, and they said it was breast cancer. The thing that I've found, there hasn't been enough literature or things to read from the outset, and that's what you need, because if you had those, you could read up on the actual disease a little bit, what was going to happen to you. But there wasn't that preparation. It was find it out as you went along the journey, and I think that's the worst of it. And I think if you're a woman, there's more there to read. You're sitting there for radio or when you go for your checkup, and you are the only man there. You know, it would be Mrs. Smith, Miss Fish, Andrew Tokely. You know, it just feels odd when you're going into those sort of situations. You're sitting there on your own, and I'm sure they think, well, why is he sitting here? I think the breast cancer awareness should be both pink and blue. It's just, you know, the fluffy ears, the pink t-shirts, all that. It's just too much that way. In my opinion, it should be that it's both genders' disease. It's not just a lady's disease. We agree it affects women a lot more than it does men. I think the ratio is about 42,000 women a year, and there's about 300 men. But those 300 men are just as important in the world as the 42,000. So if you don't raise the awareness, they can have a problem. I even contacted Race for Life, and at that point, men could not even run Race for Life. And I don't think they can now. It was just purely a pink day. Once you finish radiotherapy, you're then put onto tamoxifen. If you read the side effects on the pills, every side effect is for a lady. There's one or two which could affect us all, things like, you know, pain and swelling to the calves of your leg, or chest pains, or shortness of breath. Haven't experienced many of those. But then it also says you could have vaginal bleeding, vaginal discharge, or you could have problems with the lining of the womb, or hot flushes. Well, not many men have those. I haven't had a hot flush at all, but you read it and you just think, well, what's he going to do, you know, to me? And it's only a piece of paper. Well, it wouldn't take a few sentences to say what it does to a man, and that to me is bad in a way, because, you know, we're all taking the same pill.